Good morning, class. For today's flip class, we will be talking about the male reproductive endocrinology. So, this is one of the harder topics in endocrinology. So, I hope you will be able to catch up with the lecture. You can play forward or replay slides where you have a difficulty understanding the topics. Our reference for today will be, as usual, your Harrison's textbook. So, at the end of this session, you guys should be able to recall the male reproductive physiology. You should be able to identify clinical presentation of male hypogonadism and, of course, learn the approach to the diagnosis and treatment of male hypogonadism. So, it's all about the guys today. So, I hope you guys will be able to appreciate your own physiology and be able to identify if there's a problem with your own male physiology. So the predominant hormones that are in play with your male reproductive physiology are your androgens, and these are male sex hormones. Androgens are any steroid hormone that has masculinizing effects. So these androgens are mainly produced by your testes. To a lesser degree, it can also be produced in your adrenals, but the testes will be the main endocrine gland that will produce your androgens. And the primary testicular hormone will be, of course, your testosterone. There's also your dihydrotestosterone, which is the most potent androgen, mainly responsible for a lot of your masculine features. And lastly, of course, your androstenedione, which is the most abundant androgen and serves as the major precursors for most of your sex steroids. So your testosterone or is the major androgen synthesized and secreted by which cells do you think? So correct, it's your Leydig cells. So the testosterone is mainly produced by your Leydig cells, and it is most numerous in the newborn period and after puberty, because this is the period where most of your sexual characteristics will have rapid growth and development. And during the period between newborn and puberty, mostly in your childhood, testosterone is at a very low levels because at this period there's not much sexual development going on. So 97% of your testosterone are either loosely bound to albumin or tightly bound to your sex hormone binding globulin, which prevents it from being rapidly metabolized by your liver and hence prolongs its half-life. So how is testosterone synthesized? So your testosterone in your Leydig cell, the main precursor would be, of course, your plasma cholesterol. And your plasma cholesterol can be synthesized de novo inside your Leydig cell or from your circulating cholesterol. So your cholesterol is transported similarly to in your adrenal glands. Your cholesterol will be transported inside the mitochondrial membrane by your star. And your star is your steroidogenic acute regulatory protein. And it's the first rate limiting enzyme in the synthesis of your testosterone. This is followed by, of course, the second step in your steroid synthesis, which is the conversion of your cholesterol to your pregnenolone through your cholesterol desmolase. And your pregnenolone will now be converted either to your 17-OH pregnenolone or your progesterone. But eventually, you will end up with your androstenedione. And your androstenedione will now be converted to your testosterone. If you go this pathway, your androstenedione will now be converted to your testosterone. Okay? So next, I mentioned earlier that testosterone is usually highest in the newborn period and in puberty. And as you can see here, this graph shows us the different stages of male sexual function. So male sexual function fluctuates when there would be a lot of sexual development um, going on, or development of your sexual characteristics. So of course, in the fetal period, when you're still inside the womb of your mother, um, your plasma testosterone starts to go up, and this one facilitates the development of your male reproductive system, whether your development will proceed from either the Mullerian or the Wolffian ducts. So if the Wolffian ducts are the ones that developed, then you become a male um, baby. So during the fetal period, the testosterone that will be eventually produced by the testes inside the fetus will produce now your testosterone, and then it will gradually fall around the third trimester, and then it will now increase again in the neonatal period, where it will facilitate the growth of your penis, as well as even the descent of your testes into your scrotum. And in childhood, it will be at very low levels, and it will start rising again to your during puberty, where it will facilitate the development of your secondary sexual characteristic, and it will remain high in most of your adult life, but it will gradually decline with old age. And also in this graph, you will see when the sperm production will start to develop, which is during your puberty, and this parallels the levels of your testosterone levels in your body. So what is the function of testosterone? As I mentioned earlier, it's very crucial in fetal development. And during fetal development, that's the time where you develop your male body characteristics, the development of a penis instead of a clitoris, the development of a scrotum instead of a labia, and the development of your prostate gland, seminal vesicle, as well as your male genital ducts. In puberty, your testosterone now will facilitate the enlargement of your scrotum, and as well as the elongation of your penis, the enlargement of your testes by about 8 times, your pediatric size, as well as the development of your secondary sexual characteristics, which we will discuss later. During puberty, um, this picture shows the stages of male genital development. So during childhood, the penis and the scrotum would look like this, but when puberty starts, your testes will start to enlarge, become bigger and bigger, and then bigger into its adult size, and the penis will become gradually longer and longer to an adult size, and you will also see the development of your pubic hair. And these ones are facilitated by your dihydrotestosterone. So here are the pubertal events in males. As you can see, the testicular volume will be the first one to start increasing, followed by the development of your genitalia characteristics, such as the elongation of your penis, as well as the increase in corrugation of your scrotum. And then the last characteristic that will start to develop during puberty would be your pubic hair. And then you can see also that it is also in puberty that you will have a marked increase in growth spurt in terms of height. So see the rapid velocity of your height development during between 12 to 14 years old. So this is what we call Tanner staging. I hope you're all familiar with this. So you'll be able to actually gauge how much secondary sexual characteristics your patient has developed, and it will tell you whether the secondary sexual characteristics are normally developed or underdeveloped, and the degree of underdevelopment. So mostly you'll see it's characterized by different lengths in your penis, as well as the amount of pubic hair, the degree of size of your testicles, as well as the pigmentation and corrugation of your scrotum. So you can actually grade the physical characteristics of your patient's genitalia. So in the fetal development, as you were talking about earlier, your testosterone is very crucial in the descent of your testis from its intra-abdominal location during around the second month of gestation. It will now start to go down along your gubernaculum of the testis. At the seventh month, you'll see the um, testis will continue to go down, and then at turn, when the baby is about to be delivered, it should be around already in your scrotum. Okay, so sometimes patients will be born with an undescended testis, as in this case this is called your cryptorchidism. Sometimes we wait for the newborn period for it to fully descend, because remember that there's another increase in your testosterone during the newborn period, and the increase in testosterone will actually help your testis descend down further. But if this doesn't happen, then some patients can be given gonadotropic hormones, which will stimulate your Leydig cells of the newborn child to produce more testosterone, and this testosterone will now help your testis to descend further, so that you can avoid surgery. And of course, we want a descended testis, because an intra-abdominal testis or an undescended testis increases patient's chance to develop what? Testicular cancer. So in puberty, these are the functions of your testosterone. It has effects on the distribution of your body hair. So look at your seatmate. Okay, as you can see, you will develop now hair growth in your chest, in your forearms, as well as here in the linea alba in the abdomen, up to the umbilicus, on your face, your beard, okay, and your goatee, as well as your back. And then later on, it will also be, your testosterone will also be responsible for your male pattern baldness. And you can see here the difference in the escutcheon, the hair in your mons pubis area. In the male, it's an inverted triangle. It's an upright triangle, while in the female, it will be your inverted triangle. So when you go home, inspect your escutcheon. If it's an upright triangle, that confirms you're being male. But if you have an inverted triangle, maybe you should think about whether you're really a male or female. Just joking. Okay? So what are the other functions of your testosterone? Of course, you will now start to develop voice changes, and this is mainly because of the hypertrophy of your laryngeal mucosa and the enlargement of your larynx. And you will also notice that it is also during puberty that you will develop thickening of the skin, as well as development of acne, and this is testosterone working on your pores. Okay, and what else? So if you have, there are some patients who have who develop excessive acne from a period of long time of no acne. accompanied by some virilizing features, then that could signal the start of a possible testosterone producing hormone or disease states like polycystic ovarian syndrome where testosterone is increased over estrogen. What are the other functions of your testosterone? So you can increase your protein and muscle development. So this is a very popular drug for bodybuilders. In order to hasten the development of their muscles, they inject testosterone, but this is not a recommended practice, which I will explain to you later why. So if you have hypogonadism or lack of testosterone in males, then you will see some form of muscle wasting. Look at the arms, okay? There's not much muscle bulk, as well as lack of muscle bulk in the chest, in the pectoralis muscle. And as you can see also in this patient, the patient doesn't have much facial hair. So that's a picture of a patient with male hypogonadism. So the testosterone in males also explains the difference in the muscle mass between males and females during puberty. Okay? So your testosterone also has effects on the pelvis, and your testosterone will now be responsible for narrowing the pelvic outlet and lengthening of the pelvic outlet. Gives the pelvis a funnel shaped like, and there's also a great increase in the strength of the entire pelvis for load bearing. So this explains the difference between the narrow hips of males as opposed to the wider hips of your females, and this is mostly an effect of your testosterone. And your testosterone also has effect on your bone. It increases your bone matrix and increases calcium retention. That's why patients with hypogonadism are at a high risk for osteoporosis. What are the other functions? Your testosterone is also responsible for increasing your basal metabolic rate, also increases your red blood cells. That's why if your patient is on testosterone replacement therapy, it's very important to monitor their hematocrit. It also has some effect on your electrolyte and water balance, but to a lesser degree. So, most of the effects of testosterone result basically from an increased rate of protein formation in the target cells. So, this phenomenon has been studied extensively in the prostate gland, which is one of the organs that is mostly affected by your testosterone. So, in this gland, your testosterone enters the prostatic cells within a few minutes after its secretion, and then it is now converted by an intracellular enzyme, which is your 5-alpha reductase, to dihydrotestosterone. Your dihydrotestosterone, on the other hand, will now bind with a cytoplasmic receptor or an intracellular receptor, which now binds to your nucleus, which facilitate transcription of your genes related to sexual differentiation, virilization, spermatogenesis, and all these products will now provide a negative feedback to your pituitary to have its effects on LH, whether it's increased, suppressed, or stimulated. So your testosterone stimulates production of proteins virtually everywhere in the body, although more specifically affecting the proteins in target organs or tissues responsible for the development of both primary and secondary male sexual characteristics. So let's say your dihydrotestosterone would have effects on the skin cells, in your pubic area that will now stimulate the production and development of your pubic hair. So that's mostly an effect of your dihydrotestosterone. And it will also, your dihydrotestosterone will also have effects on your face to facilitate development of your facial hair, your axillary hair, and your chest hair, as well as your abdominal and forearm hairs. And those are all effects of your dihydrotestosterone, among many others. Again, remember your hypothalamic pituitary gonadal axis. So your GnRH from your hypothalamus will receive information from the environment as well as from the rest of the body, and your GnRH will now be able, which is produced in pulses, will stimulate the production either of your LH and your FSH. Okay, your GnRH pulses will determine whether it's your LH or your FSH that will be produced. So your LH will now stimulate your Leydig cell to produce testosterone, and your testosterone now will go to your Sertoli cell to have its effect on sperm development. Your testosterone can also be converted to your dihydrotestosterone or your estradiol. And the actions of all these androgens will contribute to sexual development, skin and hair, libido and erectile function, sperm production, bone and muscle behavior and cognition, as well as effects on gonadotropin production. And now your testosterone will provide a negative feedback to your pituitary and your hypothalamus to decrease either your GnRH or your gonadotropin secretion, primarily your LH. So again, your GnRH is secreted intermittently a few minutes at a time, once every 1 to 3 hours. And your GnRH will now stimulate the increase of your LH and your FSH from your anterior pituitary. Okay? And your LH and FSH will now have an effects on the testosterone and your spermatogenesis respectively. Your FSH or your LH will now target your interstitial Leydig cells to produce your testosterone. On the other hand, your FSH will now have an effects on your Sertoli cell, and your Sertoli cell now will produce your inhibin. And your FSH will promote growth and development of your Sertoli cell, and your Sertoli cell will now be the ones responsible for supporting your sperm cell development and maturation. The inhibin B will now be the one responsible for providing a negative feedback to your pituitary in order to decrease or increase the production of your LSH. In the LH axis, it will be your testosterone that will provide either a negative or a positive feedback. A negative feedback to your pituitary to either suppress or stimulate the production of your LSH. So, as I mentioned earlier, a portion of your androgens will be bound to albumin or your sex hormone binding globulin, and a small amount will be your free hormone, mostly your free testosterone. And this one, the ones that's bound to albumin and your free testosterone, will be the ones that's bioavailable and will produce the effects of testosterone into your cells. So your testosterone, those that are will 6 to 8% will be acted upon by your 5-alpha reductase, which will be converted to your dihydrotestosterone. So this enzyme is very important. So again, the enzyme that facilitates the conversion of your testosterone to your dihydrotestosterone is what? Your 5 alpha reductase. And your dihydrotestosterone will now be responsible for the appearance of your external genitalia, the development of pubic hair, the elongation of your penis, the hyperpigmentation, increased corrugation of your scrotum, as well as the development of your acne. Your dihydrotestosterone is also responsible for your facial and body hair, as well as the male pattern baldness that is present in elderly males. Although the male pattern baldness would also have some genetic component to it. So some people will be get bald earlier, some people will never get bald. So there's a genetic component to it. It's not just dihydrotestosterone. Your testosterone, on the other hand, will now have its effect on your Wolffian duct, so that you will have male reproductive organs. It will also have effects on your bone formation, muscle mass, as well as effects on your spermatogenesis. A small portion, about 0.3%, will be of your testosterone will be converted by your aromatase to estradiol. So remember, the enzyme that converts testosterone to estradiol is what? Your aromatase. So please remember these two enzymes, 5 alpha reductase and your aromatase. Okay? And your estradiol will also provide hypothalamic pituitary feedback. It will also have a role in bone resorption, because you don't always have to form bones, you have to balance it with bone resorption as well. And it will also facilitate epiphyseal closure, so you don't keep on growing and growing and growing during puberty, because now you have eunuchoid characteristics. And it also has an effect on gynecomastia and some vascular and behavioral effects. So sometimes patients with increased production of your some patients with liver disease will have a decrease in the breakdown of your testosterone. And the decrease in the breakdown of your testosterone, some of this testosterone will be converted to your estradiol. And the increase in the estradiol among patients with liver disease now will manifest as gynecomastia. So patients with liver disease can present with gynecomastia, and this is because of the decrease in the metabolism of your testosterone. Hence, it becomes channeled to this enzyme, your aromatase, to be converted to estradiol, so you will have elevated estradiol levels. So this is the end of your review of male reproductive physiology. On part 2, we will be discussing male hypogonadism. Okay, I'm lost. Where are you, quick time?